People seem to think that there is this rivalry between dermatologists and estheticians, and you know what? They're not always wrong. But let's talk about it. Let's talk about what estheticians can actually do for acne versus what derms do, and how both can work together to create patient care, and kind of why people think there's drama when there isn't really. It depends on the person, of course, because estheticians are people, doctors are people. But what is the difference between seeing an esthetician and seeing a derm? And when derms exist, why would we see estheticians? Or when estheticians exist, why would someone want to go to a derm? Those who aren't skintellectuals really know what you can get from each. So let's talk about that. And specifically, what about acne? When it comes to acne, this is very visceral and emotional for me, because as you know, I grew up with severe chronic cystic acne that impacted my physical and mental health. I saw 23 doctors and dermatologists. They were experts and specialists, but a lot of them couldn't help. And I did see estheticians, and a lot of them couldn't help either. But the care from doctors and derms was very different than what I got from estheticians. And in my personal skin health, both are essential. But where does this rivalry come from? So the first thing we should talk about is the scope of practice. An esthetician's scope of practice is very different than a dermatologist's. An esthetician works on the face cosmetically. They can do different treatments. You can get certifications to do LED. You can do microneedling. You can also do chemical peels. And you can help people understand their routines and guide through them. When an esthetician goes through training, they can do multiple different things. It's not always working in a medical clinic, and it's not even always working in a spa. Some work on cruise ships, but you can have that very spa-like experience with lavender-scented hand towels, or you can have a very clinical experience where an esthetician works in a dermatologist's office. But an esthetician cannot diagnose or treat. So an esthetician cannot look at the skin and say, this is grade 3 acne, or they cannot look at the skin and say, this is rosacea. They can say, this looks to be XYZ, and I would recommend seeing your doctor with it. And they also can't prescribe medications. Estheticians can look at your routine, they can turn and learn ingredients, and they can help guide you on what products to use, or they can take your doctor's prescription and help to work that into a routine that's good for you, but they cannot prescribe things. Now on the flip side, what is a dermatologist? A dermatologist is actually a medical doctor, and their purpose is not always to beautify the skin the way an esthetician might, but it's to actually diagnose and treat disease. So if someone has eczema or psoriasis, it's looking at that, diagnosing it, and probably providing a prescription. And in the case of acne, it's looking at acne, judging the severity, and sometimes prescribing oral antibiotics, topical antibiotics, other medications, etc. Now the scope of that is very different, but what's the actual difference if you're struggling with acne and you want to see someone? And if we have both of these things, like why would you see one versus the other? The way that I like to describe this is like a car. Think of your skin like a car. Every single day you go in and you put your seatbelt on to drive, right? Well, that seatbelt is your sunscreen. It keeps you safe. Now, what else happens? Maybe you have some trash in the back seat. Maybe you have a couple boxes or things here and there. You kind of tidy it up and clean up. That's like your cleanser. That's your regular hygiene, your cleansing of the skin. Now, what happens when you want to do a little something special? You want to take the car through the drive-through. Maybe you just want that car to look good and really be shiny, or maybe you want to give it a new paint job or a new treatment. That's when you go see an esthetician, someone who can really help you understand your skincare and get that next level skincare. Maybe they even do a deep clean on the inside of the car. That's fantastic. It feels amazing. It helps you look amazing. But that isn't going to help if your engine is falling apart. Let's say that you have a problem with your transmission, or your engine is literally falling out of the car. That is what a dermatologist works to fix. A dermatologist can go into the engine and say, okay, what's happening here? What is going on? They can treat it and diagnose it so that the car can run and be healthy and happy. But as you can see, the car needs a driver that's making sure that it's doing its due diligence and applying sunscreen every day and cleansing to stay healthy. You need an esthetician to take it through the car wash to not only make it look great, but also to kind of clean in between those cracks, or to help with guiding of, hey, have you thought about organizing your car in this way? Have you thought about organizing your routine in a new manner? But then you need the dermatologist to make sure that the car isn't falling apart, to make sure that you don't have skin cancer or things of that nature. But in the case of acne, what's the difference between going into an aesthetics office versus a dermatology clinic? Now, again, an aesthetics office for acne is going to be different than if you go to a spa per se. But when you do see an esthetician for acne, the booking is generally a lot easier. You can probably get in within a week or so, or even same day, whereas with a dermatologist, it can take weeks if they're booked out, or depending on medical insurance, it could take months. That's also where the cost comes in. If you you have medical insurance, you might be able to see that derm for very cheap, but without medical insurance, that could be $500 or $1,000. In aesthetics, you can get a consultation from anywhere from $30 to $300. And although insurance doesn't cover that, a lot of estheticians or aesthetic offices actually have discounts or kind of free consultations built in. Now, some of the main differences are the actual treatment and care that you get. When you see a dermatologist, depending on their policies and insurance, you might see them for 15 minutes, maybe 30. And a derm, will assess your skin and maybe touch it, but they're not going to sit there and massage your face. They're not going to apply products for you, put on a mask or something fancy like that. Their job is to look at the skin, to assess it, to diagnose, and then to help write prescriptions and treat. Whereas with an esthetician, you're not getting 15 to 30 minutes, you're getting about an hour, sometimes even up to an hour and a half to 2, and you might be booking different treatments. Almost all aesthetic visits that have a facial include steam, a cleanse, some sort of a treatment, and then of course serum and finishing steps like a sunscreen, but quite often extra things are added on. Things like microdermabrasion or LED light therapy. Things like chemical peels like salicylic acid for acne that's at a higher concentration than what you can buy without a license. So it's different than what you get over the counter. Or things like extractions, especially in the case of acne. But extractions are done by hand and very gently so they don't cause inflammation to the skin. And unless you are an aesthetic nurse or practicing underneath a physician, you cannot lance the skin. So you cannot dig into the skin or cut things out, right? That is for the dermatology clinic. But while a derm can provide that clinical expertise and really kind of get to the point and get that diagnosis and prescription taken care of, aesthetics is a bit more nurturing. You spend more time with the esthetician, so you're speaking a little bit more. Sometimes you just fall asleep and it's very relaxing, but it's more centered on touch, massage, relaxation, and actually helping with acne or with whatever is going on, in addition to providing some of those extra treatments, and you usually get a little bit more time with someone. One of the other major differences is how often you can see someone. Again, for a derm, you might have to wait 3 to 6 months, especially if you have insurance and you need a referral from primary to a derm specialty, whereas an esthetician, maybe you could call them up, you could see them same day or a week later. And another thing is the frequency. You can see an esthetician as frequently as you want to, right? The sweet spot is about once a month, and if you do have acne, honestly, even twice a month, but regularly to kind of track that progress. And honestly, you kind of end up becoming like friends, or it's almost like an acne therapist, someone who helps you. Because in the aesthetic room, a lot of people open up to you, or to me. If you are going through acne, it is very natural to really open up to that esthetician when there is that understanding of acne and when there are certain boundaries put in place, right? Whereas with a dermatologist, you could try to see them once a month, but unless you have a new clinical presentation, they're probably going to write a prescription and say, come back in 3 to 6 months to see how this is actually working. Because again, they've got a lot of other things to do. They've got Mohs surgery to complete. So how often you see an esthetician versus a derm can also really vary, and it also depends on what you're looking for and what is best for you in your schedule. Now, when it comes to products, there's also differences. Not every esthetician is trained the same, and that's why actually seeing someone who's a certified acne expert or knows products well is really important. Some estheticians really think that parabens are bad, or that PEG is horrible, or dihydrogen monoxide is gonna kill you, when dihydrogen monoxide is just water. And unfortunately, that's not standardized across the board. But that is why seeing someone who is trained is really important. Now, how that's different from a derm clinic is that doctors, dermatologists, do go through different chemistry training, but they might not know all of the products that are available over the counter either. They definitely know prescriptions, they know mechanisms of action and how those prescriptions work. However, they might not be familiar with all of the products that are over the counter or exactly how they work on skin. And many doctors recommend prescriptions to treat a condition, but they don't always share how it works with your current routine. Some doctors are really great and ask what patients are currently using, but other doctors just kind of shrug and don't even ask what you're using at home. Whereas usually estheticians will actually walk through your routine with you, actually showing you and helping you understand how to apply things. Now, derms can do the same as well, but again, depending on how much time you have with that care provider, 15, 20, 30 minutes is going to be very different than if you have an hour to an hour and a half of actual treatment, and then another 30 to 45 minutes of consult time. Now, both dermatologists and estheticians are not dietitians, so they cannot give you a meal plan. However, some estheticians are dually certified as nutritionists, which I am as well. And when you see an esthetician who is a nutritionist, or when they work at a clinic or at a place that actually has a plan, they can speak about how, not for you specifically, but in general, food might impact acne, or how food might impact the skin. Now, for a dermatologist, even though they are doctors, some medical schools only go through 24 to 48 hours of training. And there are some that go through much more, but seeing as food is something that we surround ourselves with, it's sad that there isn't more medical education or medical training on it unless doctors go to actually get CEUs, continuing education, in order to learn those things about nutrition. And as far as what we know now, we've looked at different studies, and there are some things that can be impacted by food. But specifically for acne, it would be wrong to say that food causes acne, because then everyone who ate said food would get acne. But there are things such as whey protein, or there are things such as certain chocolate and high glycemic foods or dairy-filled foods that seem to trigger breakouts more in most people. And being able to speak with someone to understand nutrition, and if you think that that's a next step that you want to take, that's a really good starting point to get that coaching and that guidance to understand what to do. And then you can take that a step further and see a dietitian if you really want, or you can get an allergy test if you really want to. But having a dermatologist or an esthetician that does that is really essential. Now, as mentioned, not all estheticians are nutritionists, not all estheticians are acne certified, not every esthetician is going to have that specialized acne training. Just the way a doctor becomes a dermatologist with extra training, an esthetician can do extra training on chemical peels or on acne, etc. But when you find someone that really understands you, regardless of whether or not it's a derm or an esthete, when you can actually connect with them and share what's going on and even speak about some of those emotional things, it just helps take the weight off of your shoulders. Especially if that esthetician could work alongside a dermatologist for my prescriptions and really give me, add a psychologist in there too, why not, right? And that really, for me, would have been full patient care. So esthetician, derm, especially when it comes to acne, who is better? Again, it takes both. Just like it takes a mechanic and a car wash and you buckling your seatbelt to make sure that that car is clean and drives well and safe, it takes an esthetician and a derm and you as someone who does skincare to make sure that things are taken care of every single day. I do think that when it comes to acne, it can be extremely difficult, and if you don't have an acne expert, you should definitely see a dermatologist because it can be, so emotionally difficult and physically difficult as well. But if you do have an acne expert, or if you want to see one online, that would be an amazing place to start. And again, you can take your prescription from your derm to them to discuss about how to create a routine or what sort of dietary choices are options for you. Or you could see them, whether it's online or even better in person. You could get a 1.5 hour facial with a back peel. Then you could take certain products and information to your doctor and dermatologist and track your progress over time and make sure that you have your prescriptions and your clinical care taken care of there. When it comes to the rivalry between estheticians and doctors, it's not about estheticians and doctors, it's about individual people. And there are always some individual people who are not going to get along. And I think that there's this industry idea because people like to make up drama in their own minds. But again, at the end of the day, the person who is struggling with their skin or wanting to improve their skin, your health, your happiness, and your beauty and physical confidence is our priority. And if that means that we can work together to do that, then even better. Definitely call just for a consult, see how it feels. And if you feel it would be helpful, definitely go in or schedule a consult online and talk to someone about your current routine or what you could switch up, or speak to someone who is a nutritionist who can guide you on what foods tend to cause breakouts in some people, or what your options are if you've quote unquote tried everything else that is over the counter. Do remember that acne, once it gets to a certain point, there are stages of acne, and once it gets to a 3 or a 4, you need to see a derm. That is clinical. But a lot of people who are struggling with acne, especially adult acne for the first time or teen acne, they don't even know where to turn. So they go to Sephora and they pick up La Mer because it's expensive and it should work, right? Or they pick up something that isn't right for them, as opposed to speaking to an expert, getting that consultation, actually getting personalized recommendations for their skin, or seeing someone for an advanced chemical peel or for LED light therapy or an acne facial that could not only, make them feel good, but make them look better or have more confidence and understanding and knowledge as well. But overall, please remember to stay hydrated both orally and topically, reapply your SPF, and always remember to be beautiful both inside and out. I love you, and I cannot wait to see you in this next video. Love you guys. Bye.